We're good? All right, thank you. Okay, good evening and welcome to the regular meeting of the Orange Board of Finance. Today is March 21st. We'll call the meeting to order at 7:06 p.m. And we'll start by having everyone introduce themselves, beginning on my right.
Kevin Moffett.
Kevin McNabola.
Audrey Gear.
John Cifarelli, Finance Director.
Joe Nuzzo.
Jim Leahy.
Ajit Jain.
Kevin Houlihan, thank you. Item number 3 is public dialogue. If anyone would like to address the board. No, so we'll get right into item number 4, report from Dr. Mohammed, the Orange Board of Health COVID-19 clinic from the American Rescue Plan funds. Welcome, sir.
Good evening. Good to see everybody without the face mask.
You're telling us?
Now I know who is who. Okay, thank you for having us. I have my full sort of team members here. Board of Health Chair Christy Maggi. We have our public health nurse Lynn, Brian, and Lisa from OVNA. So as you can see on the screen, we were asked to come back and provide a follow-up. So I don't know, 3 months ago, you probably missed us, but we were in action. So hi, Jim. So Jim is here as well. So we'd like to sort of go over some of the accomplishments that have been ongoing with the support of our leadership, and I was thankful for Board of Finance and First Selectmen and all the team members to allowing us to use our activities to help our public. So Anna is here. She just joined from the Finance OVNA. So without further ado, these were the mitigation activities that we promised that we have been doing and will be doing moving forward. So COVID-19 vaccine clinic for Orange residents, ages 5 to 11 and 12 plus. Vaccine given to homebound Orange resident, contact tracing and disease monitoring, as well as the mask policy that the mask mandate that expired from the state. So how did we do it? Next slide, please. This is the team member, all the personnel from health department, school OVNA, volunteers that included nurses, pediatrician, physicians, community emergency response team members. We conducted our clinic. That's our first mitigation activity at the High Plains Community Center. Okay. And then we had pretty much, went through our experience of getting all these clinical supplies, and we used Calendly web service to schedule the appointments. We advertised about the timings and locations through different channels, through our website, through our local newspaper, word of mouth, as well as some flyers going to the school systems and as well. So next slide, please. This was the previously approved budget that was approved by this board, and thanks for John and Audrey to providing us the actual cost as of March 15th. So you can see that we were approved for $25,000 to continue our efforts towards the mitigation program. We have spent $4,370 in total, right, John? This is the total sum. So as you can see from where it went and how we use those funds for what activities. Next slide, please.
All right, good. Thank you for providing this.
Oh, absolutely. I thought you would be happy that we were within the budget. Next slide. This is, again, just a description of how our finance department is keeping the track of where the funds are being used for.
Okay.
So next slide, please. This is just, I'm going to quickly go over some of the process that we used to advertise and how we used our website more useful. As you can see, the bicentennial logo and nice looking sort of the hyperlink. You can move on, Mr. Lee. Again, so this is where you would click on. Anybody from the town or those who are interested in getting those vaccines would click on those hyperlink. As you can see with the yellow arrow, you can move forward. Yep, that's just an announcement that gets updated on a monthly basis when and where location.
Good.
We can move forward. This is, yep, same thing. You can just, yeah. So when you click on that link, it kind of gives you that sort of a page. This is sort of our logo, town logo. It's user-friendly. You can see those highlighted dates. You click on it, and then you see all the appointments that the clinic will be operational. So anybody can go based on their availability, after work, during the work, and all that. So we provide we tend to provide some of the flexible time to kind of encourage our residents to come. Yep, and then you enter your demographics. This is all for capturing the data, right?
We talked about that, right?
Yeah.
Yeah, good job.
We always want to get the demographic data.
Yep.
And this is, again, just to make sure that what type of vaccine we have to prepare, get ready for. There are different sorts. Only Pfizer is approved for the pediatric population. The rest are okay with the adults. So, again, it gives us some sort of operational, planning. And then once you register, you get this email confirmation to confirm your appointment. Simple, right?
Yeah, we get those when you go get a haircut down at Ultimate Image or down Jimmy Renee's. No, I mean, I'm just telling you, I'm used to it now.
Now, you must be paying $50 for your haircut. I never get any online appointment.
No.
My barber doesn't charge me that much.
It's cut my hair for 40 years, doctor, and we're not close to halfway to $50. So,
All right, fair enough.
Okay, so.
Fair enough. So
Yes, sir.
let's going back to the health department. So this is the forms that we have people fill out. This is
Right.
called consent form.
Right.
It's required by DPH, by all those. I mean, if you have had your vaccine, you must have signed your life away, right? You remember doing that? So pretty much the same consistent lingo, medical legal, that, there's no pre-existing conditions and so on and so forth. They have spoken to your pediatrician. This is the CDC fact sheet that we give to parents and adults, whoever may check in. Again, straightforward, it's standard protocol that you get at Griffin or Yale or anywhere else you go to.
Okay.
After that, you can move. Yeah, this is our flyer that we put it up on our webpage, and we also give as a handout. Now, what it is basically pretty consistent, concise tips, right, based on our CDC and pediatricians guideline, what to do if you have some symptoms, mild symptoms, or other questions that you may have. So it just, again, I thought that it's a good practice. We're not like a pop-up clinic or something. We want to do things in the best effective way that parents feel comfortable and confident. Again, these are just a brochure to give some information to parents.
Okay.
You can move forward again. Flyer. I just wanted to give you all type of flyers that we created. This is again another fact sheet for the ages 5 through 11. Yep, this is the survey. I always like to do a survey. This will tell us if we're doing a good job, how effective it is, and is it really, this is for the public, for Orange residents, and if they're really benefiting it from. So I'll provide the survey, the results of this survey at the end of my presentation. So simple questions, one-page survey. People will fill out voluntarily and give us sort of the idea how good we are doing. All right, let's get to the data. Any questions so far about the planning and advertisements and all that?
Was this a file, who created this file?
I did in a public health.
Was it created in PowerPoint and then you saved it as a PDF?
Right,
I believe so.
Nice job.
it's a team effort. So thank you. So this just gives you a pie graph of showing that 55% of our participants or those people who received vaccines were female and 44% were male. If you move to the next slide, you can see the different categories of types of vaccine, the first dose, the second dose, and the booster series. I think the second highest was our first dose.
Yep.
So it tells us, and I'll go into that a little bit more in depth, why we think it's very important to capture that piece of population.
What's the base number of which this is 100%?
Correct.
No, what's the
What
number
we-
that's 100%?
We'll get there. We'll get there.
Oh,
We'll get there.
it matters when I'm looking at percentages.
Right. The N is not there, but it's you will get there in the table later
Okay.
on. I mean, I can give you, it's like about among 60.
Okay.
Okay, so roughly
Okay.
60, not including the March. So this is, again, the age description. I mean, you see where the data lies. So you can see 24 of the vaccine were first doser, right,
Okay.
out of the other. So just to give you a good perspective that, and I'll go into the details. So next slide, please.
Yep.
This is a little bit more categorization of demographic. Hopefully this will help you. You can see that majority were among the age group 5 to 11. This was our target population. And then, I mean, we didn't ignore adults and youth as well. So age, gender, and dose.
Okay.
Okay. If you go to next slide, this will give you a little bit more perspective on individual clinics. We have had 3 clinics. You can see the February 16 clinic. We had 32 scheduled appointments through Calendly that I showed you earlier, and then 4 were walk-in. So we never turn away anybody who may decide at the very last minute to come and get the vaccine. 16 were adults, which is 12 plus, and 16 were given as a first dose. Pretty significant. And then on February 22nd, you can see that there were 20 scheduled appointment and 3 walks-in. First doser were 6, second doser were 3, and 14 were boosters given on the second clinic in February.
Okay.
Then we come March 17th, we had 11 scheduled. And Lynn, how many walked in? Do you remember?
3 walk-ins.
Okay, thank you. So this was just happened, last week.
Roger. Okay.
And then homebound vaccines, as we get on a weekly data. In fact, today we got another homebound request, and we have to provide those homebound, those who are disabled, elderly, or have any reasons that they cannot go to the clinic. So far we have given 5 individuals in our town. Those are homebound. They are 100 years young, 95 years young, and 97 years young. Which is very exciting. And these were females, and the males were 94 and 98 years young, respectively. So these are and as I mentioned last time when I came here, that Orange has one of the highest older per capita population in the state. So we have to be sensitive to that population.
Okay.
Okay, so the next slide will give you the denominator. 59 people who were vaccinated. During the time, we had to discard 18 because once you open the vial, you cannot, reuse it if it's not being used within a certain amount of time, and that's sort of a safety protocol and shelf life.
Okay.
Right. Next slide. This is just a CDC card that everybody gets. You should all have your card. Do not lose it, please. This is really a problem if you lose it. We have had people calling us from last year that, hey, they lost it and things of that nature. So please don't laminate it, but save it. This is the next slide. You can ignore the next slide because this is the old data from Board of Finance.
Okay, thank you.
Going back, this is our cost sheet that what we spend on medical supplies, approved budget, the cost of clinic. Obviously, it's not reflective of the latest numbers that John had provided. We estimate reimbursement based on Anna's calculation as of March 15th will be about $1,200, right, Anna, roughly?
Yeah, when I talk, I'll talk a little more about
Okay.
that.
Okay.
That was a low estimation, but I can go into that a little more.
Okay, I basically provide all the information to Anna, and she has a real dollar sign or value,
Yeah.
right? Okay, so this is just the estimated version of it.
Okay.
It seems like different rates for homebound versus different insurance carrier, right?
That's right, yeah.
So where we stand, if you look at nationally, 16.7% of 5 to 11-year-olds have received their first dose. In Connecticut, almost 26% of the same age population have received. In Orange, however, we are almost 52% of 5 to 11 years old, so more than half, which is very reassuring. And based on these data metrics, I provided my guidance to school district to make the mask as an option. If you have children vaccinated, teachers 95% or so vaccinated, right, Jim? I mean, you probably know a little bit more on the school administration side through the Board of Ed. So I basically recommended this to keep that as an option and keep encouraging for the vaccination for those who would like to see us and make it, make those clinics available locally for everybody so they don't have any reasons not to receive it because it's safe and effective, and thankfully we have been receiving very good survey. So next slide will give you a little bit of summary of the comments that were received on the survey. It's always good to see where you stand and get the feedback from the community. Obviously, they appreciate all what the town is doing for the public. We have been there thick and thin, during the tough time last year as well, when other folks were having VAMPS issues, as well as not getting appointment. We were there. Similarly, we started a little late, but at least we have started moving forward. And these were the surveys that majority of the recipients said this was convenient. One father came to me, and his children go to the nursery school, and said, "I'm so thankful you have pediatrician and nurse practitioners from pediatric specialty to giving my child the vaccine." And I couldn't be more thankful, because I don't have to worry about going into pharmacy or some other areas where you have these techs who are not trained clinicians. Again, no offense against anybody, but I always thought that if we have the expertise, and these are, by the way, volunteers, and I was there throughout for addressing any questions that they may have. We have lovely community. We all are there to support each other, and that's what happened to provide this. So I'm very thankful to the team that came up and helped us provide this service, essential service to our town residents. And as I said, they were very satisfied. If they had any issues, they would have told us immediately to rectify any of the negative experience they may have. So successful outcome. It's part of the essential service that I had discussed with you last time when I came in. We have to provide this for homebound and for those who are disabled, as well as and if we provide the more convenient experience, more professional folks to give the vaccine, address any issue. Again, this is encouraging. And as I mentioned earlier, 51% of the town of Orange children in the age group of 5 to 11 have been vaccinated. We got positive survey results. The cost to host these clinics was extremely rare. We were very thankful of you to approve the budget in the first go, and we wanted to make sure that we remain within the budget. So this is sort of, an ongoing, and the fact that you saw so many people for the first doser is an encouraging sign. As I said, they trust us. They know that town of Orange is hosting this clinic. They have seen us in action last year. So it just, these are the same parents who received the vaccine the last year, who came and brought their children or were waiting for the town, and we received calls. OVNA received tons of calls. I personally received emails. I'm sure Jim must have received some emails, like when is town offering the vaccine and things of that nature. So I wanted to go with full preparation, with the blessing of the town leadership. We made it happen. It was very difficult initially, in a sense that we were doing it. It's very difficult to stop and then start. So having something consistently. Now, if you ask me, I'm sure you're going to ask me what's the plan is. I'm going to make it sort of very clear that, yes, with the ongoing knowledge and quite frankly, when the mask mandate went off end of February, that actually encouraged parents to go get the vaccine for the first time, right? So they wanted to get their kids. It's not that we're not seeing cases, but the cases have declined significantly, thankfully, after the Omicron surge. And right now, I think if we just keep it on a lower scale, maybe one clinic a month ongoing until we see what happens in fall or in summer before the school, we will calibrate the demand versus the public health situation. I think we should be all set. We're not here to ask for more funds. We're here for your blessing and support to understand that this is one of the essential service. And I'm thankful to be working in this town for a lot of folks who are truly vested. All of you, including us, who step up and offer these service to our to our residents. So I don't want to ignore anybody. Children, youth, adult, everybody's welcome. I like this strategy. What Selectman has proposed. Just keep offering this in a sense that when we can, within our budget, we have the resource available. We have volunteers. Again, it's not too much cost towards the fiscal budget. So this is my plan. We were going to just do one clinic per month for the time being until we see how things are. Maybe in fall, if we have a different strain or the boosters are approved by the CDC, and then we will calibrate accordingly. So I'm happy to take any questions or any suggestions, recommendations, advice.
So John and Doctor, the the page at the beginning, the $4,370, that covered the cost for two, and then you said there was a third clinic on March 17th, which is not in here, but, so we're, for two clinics, you know,
Right.
4,300, we have the nurse, we have the administrator, and then the supplies.
That's
So
it.
that's that.
And the backup was one of those other, sorry, the backup was included later in the slides. You saw the
supplies.
labor.
Yeah.
The labor also, there was the Excel sheet on the labor.
Oh, you mean the next thing here,
Yeah,
John?
there's your labor, that number should agree to the labor number there. and
2852? 2852,
28.52.
and 22 cents.
And then the 275.
Yeah.
And there it is.
And then the other slide should back up his supply thing.
Okay.
That's through the 15th, that doesn't include
So there's one
anything.
more, but still, I mean, that's.
Right.
Still
I think,
That's lower than 20, that's great.
I think I approved the bill last week for like $200 for the EpiPens.
Yeah. So we have
So
to keep
that
that,
wasn't
yeah.
in there,
We have to keep
yeah.
that for any anaphylaxis reaction.
Those were the costs as of the 315, as you see down the bottom there.
Yep.
You were going to comment on the reimbursement, you wanted to talk about that in a little more detail? You want to
Yeah.
Anna, you want to come up?
and,
I'll stand right
yeah,
here.
talk us together, and I'll try to find the slide that we were,
Now, Anna sent that email that I sent you today.
Yeah, I didn't prepare a whole PowerPoint. So the reimbursement is quite confusing, actually. It's, every insurance is required nationally to reimburse us no matter what. For the administration, obviously not for the actual vaccine, because the vaccines we got for free. So there are insurances that we contract with to vaccinate any residents or members of their insurance, like we do for the flu, right? So if we have a contract with that insurance to vaccinate them, such as Anthem or Aetna, we will be reimbursed at that $16 rate, which is what I provided to them. So that's the lowest rate actually, I shouldn't say that. Let me back that up. So that's $16. That's what I provided to them. The allowed amount, what they're saying is $40. Okay, that's the Medicare allowable amount for the administration of the COVID vaccine. So we could be reimbursed up to $40. But I didn't want to give that rate because there are insurances that, because they're private insurances, they can basically make up their own rules. They really do not have to reimburse you that amount. Like I said, we're going to get $16 from our insurances that we're contracted with because that's our contracted rate.
That's a negotiated rate.
Correct, exactly. So the insurances that we're out of network with, they really can reimburse us whatever they want. It doesn't, there's no rules. So I don't know what they're going to come back as. So they have to reimburse us something. It's a law, basically. So it's not like we'll get zero, but we'll get something. We just don't know what it's going to be yet. The Medicare, traditional Medicare, is very good, actually, but we don't have that many of those right now. Traditional Medicare is $40 flat no matter what, and if they're homebound, we get an extra $35 on top of that. So we get $75 for those.
So these are very conservative estimates that you see on the screen.
Correct, yeah. So it could be all over the place. And my other concerns are that this is the first time that we are billing to these insurances for this particular service. Private insurance companies deny claims like it's their job. That's what they do, okay? They send back claims for no particular purpose. I had flu claims that I've been billing for 7 years, and they tell me it's on the wrong form. I bill it every year on the same form. It's not on the wrong form. They just make you take the time to call back and,
Rectify the issue.
They want you to give up.
That's exactly what they want. They want you to.
$16 for $16.
Yeah.
That's exactly what they want. They want you to give up, right? So it's a matter of taking the time, spending the time to do this. So it's a very, very timely process to bill all of this stuff, to research what each insurance wants you to do. Do you have to put the NDC number, which is the National Drug Code, on the claim? Blah, blah, blah. Do you have to bill it electronically? Do you have to bill it by paper? Which P.O. box you have to send it to, et cetera. So I believe that a lot of these claims probably are going to come back denied at first, and we're going to have to resubmit them. So there's going to be a lot of time before we actually have a real number on what these clinics have generated. Just so you guys know that this isn't going to be like, 60 days from now, here's your number.
I said the last
don't
time,
know.
we're not profitable. Don't
It's a
think
public
of us.
service,
It's a
yeah.
public service.
It's for sure a public
So
service.
Board of Finance, yeah. Don't tell me that you're gonna make money
A
out
lot of
this.
smoke in the water is what I'm hearing.
Unfortunately.
Roger. Okay,
Yeah,
got it.
yeah.
Can I ask just a very brief question?
Absolutely.
But since you
Please.
surfaced who all these students are. So 5 through 11, are these orange people?
Majority of them,
For
for the most part, they could be living elsewhere like West Haven, but their kids come to Orange nursery schools. They got the message, so but majority of them are 90%. I would say roughly are Orange residents, Orange kids.
Okay, so where my question will be going is in this green thing here.
Yeah.
And again, I'm just looking
Sure.
for understanding, because you said over here that more than double, or about double, the Connecticut percentage have received the first dose.
Thank you.
In Connecticut. In Orange, we are double that, not just having the first dose, unless it's the, what?
It's complete vaccination, yeah.
Complete vaccination,
And
which
this is
could be-
old. This is also a month old. We don't get
Right.
that data very quickly compared to the overall. So overall, we're 83%.
Right,
Yeah.
we got a lot to do. So help me understand, if you had 24 of them and they were actually from Orange, that's
Yeah.
an assumption, but let's just let it go.
Sure.
How did the 575, the 599 minus the 24, how did they get their vaccinations?
So what do you mean? So you add 599 plus
This
24.
slide is telling me that 599 kids in the 5
Orange.
to 11
Yeah.
have been fully vaccinated. So they certainly had one. So
if
I'm
you-
just wondering, how did the people who didn't come to this clinic, who were in that ballpark, where are they getting their vaccinations?
Could be anywhere. I mean, I'm just saying that this could be, again, we started very late.
Yep.
The vaccines approved was back when I came in, November, December time. When did we start it? In February.
Yep.
I got my kids vaccinated right there and then.
Yep.
Okay, so they could have gone anywhere. Had we started earlier, we would have been seeing, higher number. But we wanted to capture the
Yep. Okay.
remainder. So going forward, so say for example, the second or the booster gets approved, just hypothetically, and we do offer that, and that will give us a better idea of how much services can we offer to accommodate 1199, people of that age group.
So
It's
the
hard to
plan
tell.
going forward, Doctor, is
Yes.
one clinic a month? Is
For
that
the
what you're
time
doing?
being, sir, yes. So I think we have to calibrate. We have to use our resources. I mean, it takes a lot of time to set up these things. You all are welcome to come. We have balloons. We have. It's
Where do you do
remarkable.
it?
Huh?
Where do you do it?
High Plains Community Center.
And the next date, if in April?
Thursday. Come Thursday.
24th.
Yes.
Oh, so you're going to do 2 this month?
Correct.
New strategy.
No. It was always February and March was 2 clinics, and then April,
Okay.
1
April.
clinic.
All right.
Yes.
Have you set the dates for those future knocks? I'm
Yes.
not being critical. I'm just asking.
For April, no. I think
Just
Lynn.
want to clarify, when somebody gets their first dose,
Yes.
they have to get their second dose. And so clearly we have to provide that.
If they have Pfizer,
Yes.
If they've had, I'm talking about the children now, the 5 to 11-year-olds. So
they can't get the J&J one.
No. Only Pfizer.
Thank you.
Pfizer. So we have to then continue our clinics to provide the second dose for those kids who, so everybody who got it February 16th came on March 17th and got their second dose. The kids that came on February 22nd are coming March 24th to get their second dose. If we have some stragglers in between that happen to have gotten the first dose, then we need to plan another clinic sometime in April, after April break vacation, spring break.
Yeah.
So that we can catch up on both of those clinics.
Okay.
And then maybe we'll be done, or maybe we'll continue on for May and June.
And if the costs remain the same,
Yeah, you have
you have enough for 9 more clinics.
Yeah, I don't
Well, eight,
anticipate, I
you
don't
know.
anticipate costs going up at the moment unless we have, huge demand and 4 to 11 years old vaccine gets approved, then we have to ramp it up and we may need to use some per diem. I don't know. I mean, again, all options needs to be considered. Like I said, these require a ton of work. The hours that you see are very conservative, hours for the nurse as well as the admin person, okay? I'm not getting reimbursed or any of my volunteers. We're there to support. We want to make this happen in a way that is conducive to the public service. We promise this is part of my essential functions of the duty to offer the vaccination programs for any communicable disease, whether it's COVID, flu, or anything else that may come in. So we have a strategy, we have a plan. I want the leadership and the Board of Finance to know that we're not just, heading or shooting in the dark. We're gonna function accordingly based on the data, and we plan accordingly. And just so everybody know that we do get some calls that people are looking for their third booster, right? So, and again, the data is being reviewed by the CDC and the national expert. Only immunocompromised people, those who are on chronic immunosuppressive medications, need those on a case-by-case basis.
We got it.
Anything else?
Anybody
So,
have any
Dr. Mo,
questions?
this is great work. My only question is what we are doing, what you guys are doing, is it optional or it is required?
No, it's optional. You mean the vaccine itself?
No,
No.
whatever services you are providing.
Oh, this is essential service. So it's part of the requirement from the state. And, anytime we have these type of epidemic or endemic or pandemic, all the other health departments are doing it. I'm not the only one. But we want to do it the way it's supposed to be done in any clinical setting. I can tell you this, Mr. Jain, that in other clinics that you go, you don't find pediatricians or pediatric nurse practitioners giving those vaccines. That's what the difference is. You don't have an MD there to supervise any activity and address any questions. And I'm being honest, pharmacy tech will not have all the answers to all the questions. Are we required? My read on it is that we have to offer these services, and then what's the public health department is for? If you don't step up in this global pandemic, I mean, it's too much work for me.
No, I can see that. That's why I asked, like, if it is
I
optional or
think
required.
it's my professional and moral duty to step up and offer these clinics to our residents. That's it. And all I expect is support. That's it. And everything is transparent. There's nothing, no hidden plan. We want to make sure that there is accessibility, availability, and all these things are happening in a very, very professional manner. That's it.
Thank you.
I think it's more than of a
No,
good reason.
I thank you, and I think you've done a great job with
Thank you very much
holding
for
the
your
costs and
acknowledgement.
everything there.
Appreciate that. That keeps us going. Good evening.
Thank you.
Thanks for putting this together. That's very nicely done. I'm sure there's some tips I could learn, for sure.
Okay. Item number 5.
All right.
Approve funds up to $25,000 from capital account for tower clocks, the Orange Bicentennial celebration.
Who's got this one?
I guess
John.
I got it. The Board of Selectmen last month voted as part of the bicentennial celebration to put up one of these clocks outside the town hall here. And by one of these clocks, I'm going to use the example of, if you go by Michael's Jewelers, in the front there is one of those
Oh, it's huge.
decorative clocks.
Thank you.
Yeah, thank you, everybody.
Oh, absolutely.
Absolutely.
Thank you.
Good.
Please email, visit on 24th, Thursday. We'll get a picture of you with the balloon and all the fancy stuff. that we have.
24th. You got a date. I'm there. Not getting a vaccine, but I'll go.
So they voted to approve a contract with the South Carolina company to build this clock, and it's supposed to be installed by the country fair, to be able to celebrate by the country fair as a
So we won't have it this
memento.
summer, but we'll have it by the
Yeah,
fair.
it's actually going to be actually built by then. It's not something that they just put together. My understanding, it's going to have the town logo inside, and it's going to be all digital. So if we continue to move our clocks forward in the spring and backwards in the fall, it automatically does that.
Where is it going to be?
It's going to be right out here, a little left of the flagpole, so you can see it going up and down Orange Center Road.
Two faces, there's one on each side.
There is some prep costs that the town has to do.
We have
We have to put in a cement base and electricity to it, but we'll take that. We'll probably pay for that in another area of the
Who
budget.
designed it?
I think the company designs it and works
Do
with
we have
you.
a
and
picture of it?
I don't have it, I didn't bring it, I think the Board of Selectmen did.
So it's up to
Something
us to
similar.
approve this $25,000?
You need to
They approved the
allocate
purchase of
They
it. They're
approve
looking
that
for
you
the
have
money.
to allocate the money.
This is the bicentennial
Yes,
group?
yes.
That would be,
The capital account. This will be a fixed asset, so it's a capital account item.
okay, well, if you need,
I don't know
you
if
need a
Jim wants
motion, do
to-
we need a motion on this, or?
add anything? Nope.
Well, if the Board
Yeah.
of Selectmen approved it,
So we're just,
A motion
We
up
have
to
to fund it.
$25,000
Yeah,
from the capital account.
fine, I'll make the motion, let's.
I'll
keep
second the
rolling here.
motion.
any further discussion? All those in favor?
Aye.
Aye.
Opposed, abstained?
At the Board of Selectmen meeting.
Unanimous?
Yeah, it's nice. Yeah, real nice.
I'd like to-
All right, before we go into our budget workshop, Jim would like to move his report, so it's covered by television. So I need a motion to move item 8B to become the new number 6.
I'd make that motion, since
I'll second
it's 8A, I think. Yeah, 8B, excuse me. Yeah.
All right, there's a motion and a second. Any
Violation.
further discussion? All those in favor?
Aye.
Aye.
Aye, opposed, abstained.
Okay,
Unanimous?
this is something, I'll use the slides I used with the Board of Selectmen. I'll put a timer on myself.
3 minutes.
No, that was up at Amity. That was at Amity,
That's
yeah.
what I was saying
Yeah, they
before.
gave me 3 minutes. If you want to talk about anything at an Amity Board of Education meeting, you get 3 minutes. If your town for which you're the vice chairman of the Board of Finance, and you wish to talk about the budget they're embarking on spending 25 million of our taxpayers' money, you get 3 minutes as well. That's my world. No, 3 up there.
All right, well,
Jimmy.
we're
That's
wasting time now,
50%
so let's,
Clock is running.
Okay. So here's the deal. I made some slides to summarize it to make sure our leaders, Board of Selectmen, are understanding of stuff that you guys already know. So since you guys have seen most of these slides, I'm just rushing to let you know, people at home maybe haven't seen them, let you know what I informed of them that night on March 9th. Budget surpluses have been out there for a while. They used to be low. Last 4 years been very high, 3 million a year. I made sure, it's not intuitive, but if you have 2 greens, right, and you have a surplus, your rate of increase is not what they say from budget to budget. It's from what you actually spend to your new budget. What does the new budget cost? John and I did some numbers. He checked a few of mine. But in 1 calendar year, just focus on that. That since it's $1.5 million, Joe, that's ours. Since we averaged over that 4-year period when they had the $3 million budgets, it's a 71.1 is the total budget, 2.11 therefore was the surplus, and therefore if you paid $8,125 in taxes, you were spending and you were overtaxed $171 every single time this happened. I reminded the Board of Selectmen, some of whom did not know, that this year the request for an increase, which got approved, Joe can to bring us up on speed on that, was more than double the last 16-year average. Even though there were 68 fewer students at Amity, and they decided to add 7 more staff. You have seen this slide before. The rapid decline over the last 10 years. Not many people know this. We do, and we're trying to spread the word. Whoops, sorry, team. In the last 4 years, they've actually added 15 FTEs, even as that decline continued. So I did a calculation of what the impact would be, and it turned out to be, as Joe will report out, that they approved a 3.99% increase, which means it's going to cost us over $1.3 million in increases for fewer students or increased staff. So we unanimously approved a motion back in January to support a 0.41% increase. Kevin, I lied. I did not stop my watch on time. So when you look at the difference, what it's costing the town between what we believe they can live with and what they approved, it's over $900,000. You can see the difference between the 1.3 million and the 400,000. I even did a sensitivity analysis, a little bit of a busy chart, but if you look at the middle there, Joe, I'll focus on you, and in the yellow, you see a $2 million number right up there. 2,062,758. Now, that's an increase. But if you have a surplus, and over on the left-hand side, you see various scenarios of surplus, from 3 million down to 1,200,000, 1,250,000. And when you add that to what the budget increase is, what the major thing to focus on is the actual percentage increase that they have voted for themselves. Nothing close to under 6%. As you can see, with that surplus, with that budget increase we recommended over to the right, the 0.41% increase, that, along with the $2 million surplus, and Kevin, I remember your comment that night, if you took about a $2 million surplus with what we would approved, that would cover their increase of 3.99%. Hence the yellow on the right, married to their budget increase that they have approved. The money is there. In addition, as we all know, the surpluses in the past have been far exceeding the actual increase in the budget year, a phenomenon that's a little bit amazing. And finally, I wanted to make sure both the Board of Selectmen and the Amity Board of Education members, and this was in the article, it was in the Orangetown News, that when we look at the surpluses that they come out in one calendar year, over the last 6 years, 5 years there, you can see that when the elected officials vote on the following year's budgets, you have a surplus that's, I would say, reasonable, general. And when the town taxpayers, all of us on TV watching now, vote in May 3rd, the surplus at Amity looks reasonable. But then reality happens. And reality, I only mean this is the data. By the time we get to the end of the year, more than 3 times what we thought we saw as a surplus in that calendar year gets found. This is the data. I think all our taxpayers should know it. Do what you want to do, vote whatever you want to vote. This Board of Finances voted for support a 0.41% increase, not a 3.99% increase. And we'd like you to consider these facts when it comes time to vote on the Amity vote of its budget here in Orange, when we do that on a day separate from our vote. And this is the calendar final chart. Mr. Chairman, the Amity vote, as you can see, is up there on May 3rd. You can see our vote. I think I got it right this time. Jimmy Mitch gave me the correct dates. Our town meeting is on May 11th. And our taxpayer vote on our aggregate budget for all of it is on May 18th, which gives everyone in town have a vote on the Amity budget, have a vote on the town budget.
Just remember, the Amity budget is approved separately, then added to your budget.
Right.
So it's, even if you turn the town budget down, the Amity part stays.
Correct.
Correct.
Yeah, once it passes, we can't change.
You can't change a thing, okay?
It all comes out of the town side.
So I think that's all I wanted to do. When I started the clock halfway through, Kevin, it's been 4 minutes. It's probably been double that. I said it would take 5 to 8. I think I was grenade close. Thank you.
Okay, thank you. Let's have a motion to take a 5-minute recess, then we'll get back with our budget workshop.
Okay, motion?
Is there a
5-minute recess?
Second?
Second.
All
All
those
right.
in favor?
Right.
Aye.
Good.
All right,